And this week we've been talking about pregnancy pelvic pain. So I want to show a quick exercise that has worked really, really well with my patients. There's no 100% cure. In physio, we rarely say 100%, but this works pretty darn well, especially if you've got mild pelvic pain across the back of your upper pelvis or in the pubic bone region. So I'm going to show you one way to do it, and then we're going to talk about some ways that you can change it up. But essentially what you're trying to do, even though it can sometimes feel uncomfortable when you open your legs, you have to be able to learn how to open your legs. I mean, you want to walk, you have to get in and out of a car. And guess what position the birthing position is? Yeah, legs have to get open. So you want to find a way to do that gradually and a way that can support the pelvis and the muscles and the connective tissue when you're trying to start moving into this inner thigh stretch that we're going to do. It helps to really get some confidence for you that this is a move that you can do, and it helps for the tissues to get accustomed to doing that movement again, even though you're in this ever-changing body. So what you want to do is recline backwards. I'm doing this on top of a yoga mat, and then I just put a blanket down because really my yoga mat's just not squishy enough. You can do this on your bed, you can do it on the floor. A lot of my patients will do this reclined in a lazy boy. It doesn't matter, whichever's more comfortable for you. You can do this lying down flat all the way, but if that starts to get uncomfortable, you have difficulties breathing, you don't feel well as belly gets bigger and bigger, then come into more upright. There's no wrong way to do this exercise, and you're welcome to change it as your body changes. So what we're looking for is that you recline backwards a bit and that you open your legs. Now, if it starts to hurt when you open your legs, then use some pillows to get to a position where you can actually relax, because the whole point of this exercise is that you are in a relaxed position. If you're holding tension, this is not going to work. So you stay in this position and you can just kind of rock back and forth a little bit. Some people find that after a few minutes, they can actually get rid of a pillow and go to a more open position, and then maybe with the other side as well, until you can get to your full natural flexibility. So it can take anywhere between 2 and 5 minutes to get to that position, and then you can just hang out there for another 2 minutes. It should feel like a stretch. When you're finished, help yourself bring your legs back in, bring your legs back in. Do a couple of bum squeezes. Squeeze, squeeze, squeeze. This is my symbol for squeezing, apparently. So do a couple of bum squeezes, and then you're good to go. We recommend that you do that at the end of your mom day, if you know what I mean. So when you don't have to do a whole lot of other tasks afterwards. So a lot of my moms will do this as they're putting their children to sleep, or if they're done for the day in bed before they go to sleep, that's when they'll do it. But you can also feel free to change your foot position. So if this doesn't feel comfortable, sometimes just shifting a position change a little bit can make all the difference. You might not be equal. You can try one leg versus the other, but give that a shot and see if that can help solve some of your pelvic pain problems. All right, good luck. Bye-bye.